Thanks for joining us for the KC Ready For's 10 Videos to Celebrate 10 Years campaign. We hope you enjoy this conversation with Family Health Center CEO and KC Ready For's board member, Denise Crawford, and pediatrician, Dr. Leah Gugino, about the critical brain development that happens in the first 5 years of life and ways you can support it.
So my name is Denise Crawford. I'm actually the president and CEO of the Family Health Center here in Kalamazoo. I've had the pleasure of serving in this position over the past 11 years. It's been a wonderful and very, very changing times throughout healthcare as a whole. But most importantly, today I'm here to talk about children and child development and the impact of children as we continue through this role, as I've had the pleasure of serving on the board of KC Ready For's over the past 11 years.
Hi, I'm Leah Gugino. I'm a pediatrician. This is my 32nd year in general pediatrics. I have a particular interest in children's emotional health and well-being, and I have been the past medical director of behavioral health at Bronson Hospital, and I am embarking on some new adventures, including a podcast on pediatric emotional wellness, so hopefully you can tune into that. And I'm really involved with the Michigan American Academy of Pediatrics and the National American Academy of Pediatrics, and certainly, really support the work KC Ready For has been doing. And I've been a donor. I think the first time I ever got involved was I was invited to a breakfast, and I was just really impressed with the turnout of the community and was inspired to donate, and I've been involved ever since.
Excellent, excellent. Well, Dr. Gugino, you are very well known in your own light for a number of things, particularly centered around not only being a pediatrician, and I was shocked to learn 32 years. That is so impressive. And so on behalf of all of those phenomenal babies that we know you care about, I thank you on behalf of the community, because we know you've been instrumental in all children, underserved children, children of all different aspects of life. And in particular, we had talked about how you're really our own guru on child development, on emotional health, on the various aspects. So can you just talk to us a little bit in general about your various interests, in addition to being a phenomenal pediatrician, all of some of the other things that you do?
Wow, I appreciate that. That's really a nice endorsement. Thank you so much. I have to say, being a pediatrician is, it's a really rewarding job, which sounds maybe a little trite, but it's so true. And it's really fun. Kids are wonderful. They are so resilient. And I think when I was looking at choosing a role in medicine, it really spoke to me, because there's so much opportunity to impact outcomes in kids. And I think that's really unique. It's very different than treating a 65-year-old who has chronic diabetes, has alcoholism, is a smoker. And not to say that we shouldn't try and help those individuals too, but there's just so much hope and opportunity for intervention with kids. So I think in terms of child development, the child's brain is just so rich. And in that first life, there's just all this development of these electrical connections that are happening. And one of the things that we know is that a child's environment really impacts what happens as that brain develops. And a really simple thing is just parent language. The more words a child hears, the more impact it has on their reading. But we also know about their environment. If there is parent mental illness, if there is poverty, if there is loss, those things that we have referred to in the more recent years as toxic stressors. And the list is long, but what we know is that our brains are very plastic, meaning they can change, and that toxic events that happen to children early on can actually change the trajectory, not only of their learning, but their emotions and their physical health. So that impact is so longitudinal that this opportunity to do stuff on the front end and is the most important thing we can do. And so when I'm working with families, it's not even at conception, it's not even at birth. It's before that. Are we taking good care of our mamas? Are we taking good care of our teenagers who are going to become moms and dads? And were they taking care of his children? So you see what it's kind of back it goes. And of course, you know, reading and education is a huge part of that, for especially in those later years. But gosh, in the early years, really empowering our parents is the absolute best thing we can do.
Excellent, excellent. That is so helpful. And so, you know, you really summarize how those first 5 years of child development is critical. You know, for our parents and our educators, you know, what advice would you give on how they can foster healthy brain development throughout the entire child's life, as you indicated, but particularly during those first 5 years?
Well, I think one of the, I think absolute first thing is that parents need to be healthy themselves, and particularly emotionally healthy. Right from birth. You know, we know that moms and dads too that have perinatal mood disorders, particularly anxiety, even more than depression. So we know that how parents feel, and 1 in 5 moms suffers from perinatal mood disorders, and 1 in 10 dads. I didn't know that. That's a relatively new finding. So making sure the emotional health of our parents, their environment, children who live in poverty. We know that, you know, if you're worrying about where you're going to sleep tonight and what you're going to eat, reading a book to a child is not going to be at the top of your list. How we are with our children, even kids that come out of really tough adversity, being able to foster resilience is having an important adult. It doesn't have to be a parent, but that's usually who it's going to be, but an important adult who can buffer the adversities. That's the biggest thing that we can do, is to build our parents up and to support them. And, you know, I know that, you know, in particular, the community that you serve, many of those families do come from, poverty, and there are a lot of social determinants of health that are problematic. And so I don't know, maybe you can talk a little bit about some of the work that you're doing in your clinic, because you've got some unique things. I know you've brought in a lot of mental health providers into your facility and really embedded them.
Absolutely, absolutely. So thank you. We absolutely do. We take the entire health of the child as well as the adult, because as you say, you know, ensuring that the parents are healthy is one of the, primary components to then fostering a healthy life for the children. And obviously, you know, within our services from primary care to OBGYN, et cetera, we like to start, you're right, during that conception, ensuring that mom is equally healthy and has access to healthy living situations, et cetera, because we know that the outcome on the children are going to be that much better based on that. So, you know, with our work here in the community, and we are so grateful to have the opportunity to partner with KC Ready for FERS, we particularly focus on the overall health, the mental health, the oral health, as well as the primary care, the physical health. With KC Ready for, you know, we've been able to institute and truly partner on the well child exams as well as the immunizations. Interestingly enough, I will tell you, we're extremely concerned right now and are really proud of that partnership. As we all know, in the midst of this global pandemic, when many things were shut down, appropriately so, and we were all sheltering in place, we did, for obvious reasons, we were not, and we've seen that parents were not coming for those non-essential services, and that was heavily discouraged at that time. I think now with some of our work and our advocacy, we want to remind parents, particularly as we are looking at sending children back to school via in a virtual realm, via in a, you know, kind of a combined situation, as they continue to practice all of those safety measures centered around social distancing, wearing the mask, the overall importance of immunizations. As a state, it concerns us greatly, and you know this far better than I, Dr. Gugino, particularly with the underserved populations, but quite honestly, through all populations right now in the state of Michigan, immunizations for our children are down 60%. And so that in the midst of a global pandemic is very concerning to us. So we will continue with many of those partnerships and looking at how can we ensure that we are providing the best coverage and best safety for our children through, again, those immunizations and those well child exams. That's the lowest it's been in quite some time. And whereas we understand why, again, we're very concerned about making sure that we can bring those overall rates up. You know, and the other thing that I think is critical that we're extremely proud of is our oral health partnership program that we do with KC Ready Fours. And so within that, through a number of different venues, we're able to bring the children into the actual dental clinic where they get an exam and they get a cleaning and it's coordinated. They get to interact with the various dentists, and we talk about oral health and the importance of oral health, and really tying that at a very young age into the overall health and well-being of the individual. Understanding that, of course, primary health care is critical, but oral health is equally important. And so I've really been proud of that partnership and being able to do that, again, with the mobile health unit. And we have instances where it's an overall field trip for the entire KC Ready Fours preschools, whatever ones they're sponsoring, where they're able to bring all the children in and receive that service. And then, you know, lastly, I would just talk about quickly our annual Back to School Bash, where KC Ready Fours has always been a phenomenal partner, and we see ourselves partnering in that work because, as you know, KC Ready Fours stretches across all preschools and really has a commitment to serving all children. They were instrumental in establishing the first 4 preschools here on the north side, and we're very pleased to continue to have those where they're instrumental in assisting us at ensuring that those children, amongst all children, have access to a very healthy pre-K experience. And so with that Back to School Bash, they've always been a parent in providing the information and ensuring that parents understand the knowledge and the importance of a pre-K experience. And then, you know, just being regular partners in the overall health and the well-being and getting kids ready. Obviously, in this new environment, we are not having the fair event, so to speak, but we are continuing to have the Back to School Bash per se event where children are coming in. They will receive the well child exams. They will continue to receive the backpacks. There's actually a very integral part within the unit where we're talking to them about, we have this new wonderful character, the W3, a Superman type individual, and you know, with his W3 cape, he teaches all the children about the top 3 W's, which is wash your hands for 20 seconds and wear your mask, and each of the children will receive 2 reusable cloth masks, and then also watch your distance. So it's wash your hands, wear your mask, watch your distance. So those are, whereas, you know, it goes on and on. Those are just some of the partnerships that we've had that would not be as successful as they are without working with KC Ready Fours. And so we're so thankful for their work.
That is really creative. And, you know, I'm listening to you and it's like, all these things are going off in my head because there are so many things that we need to do and can do for kids. And it's not just, you know, I mean, it's not just toxic stress, it's their teeth. I am so jealous that you have that clinic. I mean, it's so important. I mean, it feels like, you know, gosh, a toothbrush, but you know, it's really important for children to have oral health and access, and for all kids to have access to all these things that we need to make us whole. You mentioned the pandemic, and man, I can just tell you, it is so hard on kids and families. I think right now, everybody's up in the air about going to school. Every school district seems to have something different, and I don't think we really know like what's the best thing. So some are completely virtual, some are hybrid, some are completely in person. And we're getting a lot of questions about, is it okay for kids to go back to school? And the honest question is, we don't know. We really don't know. And so I think that's scary. I feel for parents that have had to be teachers, and huge kudos to them. I think maybe kids will appreciate their teachers a lot more. I know their parents are going to. Kids' sleep is a mess right now. I would say of all the things that I've seen, sleep is really a huge thing. And these kids are up all night and then they're sleeping all day, and it's just completely turned around. And then you couple that with isolation from friends and their other social environment. And it's the pandemic is a toxic stressor. So I think, all the things that we know about the brain is that we crave routine, and trying to put those things in place. So the fact that you're doing this back to school bash, even though what that looks like is not what we think of back to school. I keep seeing the ads for back to school clothes, and I'm thinking, is that pajamas? Or
Right, exactly.
what are they going to be getting?
More
are they going to
shorts,
just
right.
wear the backpack around the house? But I used to love new pencils, new notebooks, and new shoes. That was like going back to school.
There you
that
go.
Was the best. And,
it was the kit.
There are just so many losses with this pandemic. Loss of not seeing our friends, loss of our routines, loss of events that are special, a kindergartner's first day. It's just so sad. Of course, our graduations. My daughter couldn't have her wedding this year. It's just one thing after another, and we're all sick of it, and we don't know when it's going to end. But, I think it takes all the adults to try and make this better for kids. We're the ones that are able to do that, and really in that toxic stress model, we're the buffers. So, we need to get our act together. We need to make good decisions. We need to partner. Your partnerships that you have with Family Health Center and Casey Ready Fours, and then other organizations in the community are, that's what we need to do. As a pediatrician, I'm not the one stop, that I'm the only one that can do this. I need my partners. We're really fortunate in our practice, and I know you have too, is we have social work embedded in our practices. So with families, if there is something that they need, they're right there. I don't have to say, here, call this therapist. I got them right there. And that's huge. So I think that there are models that we can do, but every community has to look at what it's got. I think Kalamazoo is a pretty amazing place. We're not huge, but we have these amazing resources and philanthropists and educational organizations. And then we're like small but mighty. We're like the little engine that could. And we're small enough, we think we can, and we can. And I think we're small enough that we can make things happen. And, I think Casey Ready Fours is one of those things that happens because there are a lot of, energy and intention to make things better for children.
That is excellent. That is excellent. Thank you so much for sharing your knowledge. I know it's just truly what you do, and it's so clear that you speak from your heart because you truly care about children and what's best for children. But I think you hit on some really key points for all the parents and the grandparents and individuals who are out there, and that just acknowledging, yes, this has been really, really hard, but also understanding from the social and emotional standpoint that we are the buffer for the children. And so at this particular time, I know that just like, you have indicated, so many people are asking, are they okay? Are they going to be okay? And so just those topics that you've shared with us are critical, meaning, helping helping kids to have stability. That, you know, parents do that, and we need those adults and those responsible individuals in their lives to continue to foster that, having very set routines and patterns, having standardized sleep patterns, eating patterns, etc., even if they may or may not be leaving the home. Making sure that those routines continue, from everything from getting up and brushing your teeth and getting dressed. Those things all play a big role into it. And then I think, you know, again, as you indicated, the importance of having the, you know, social workers and the psychologists, and we have a very robust team, as do you. And as they continue to evaluate this, just remembering and I think emphasizing what you have stated, kids are resilient. Kids have always been resilient. We know oftentimes in the population in which we serve, kids are often transitioning from various schools, various homes, various environments multiple times. And we have seen where those kids can absolutely transition into a new environment as long as there's stability at home, and particularly they are hearing from those adult role models that things are okay, this is fine, this is a new way of doing things. I think that really leads to the overall stability of the child. And so if children hear us speaking and talking about how detrimental this is and how horrible this is and how, you know, the world is awful and they never imagined they would be in the middle of a global pandemic and all of the things that go on, then they will absolutely react to that. But if we do the necessary work of stabilizing their environment, helping them to understand that this is really, really cool, you now can have school here, and then incorporating all of those necessary steps. One of those key things that I'm hearing my therapist talk about is that playtime, that interaction. We're actually at the Back to School Bash, because of the therapist. Now, who would have thought of this? But we are giving out an outdoor sporting equipment, so to speak, per choice. So I think the choice is like a basketball, a football, a volleyball, or there's one more kind of ball, and I'm sorry, I'm blanking on it. But the whole fact in incorporating that back into their lives, because that's very healthy for kids. And so again, just reinforcing the stability as well as the routine and I think the overall understanding and acumen that this is our new normal, but we're okay. We're going to be just fine. This is going to be a great school year. We can do it. I believe in you. On and on and on.
I want you to be my mom.
Oh, bless you.
You're gonna make me feel so much better. Well, and I think I think it's super important that you know, parents know that it's okay to ask for help, and it's okay to feel awful, because this is really, really difficult. And so I hope that they reach out to professionals, their pediatricians, their community folks, whether it's in their churches. You know, I think one of the hard things is we have always relied on our school personnel so much. You know, how many people have had a life change because of a teacher? I mean, that's why I'm a doctor. I had a teacher say, "Have you ever thought about being a doctor?" And that was it. I had never thought about that. So, you know, we know that those adults can make those kinds of really important changes. You know, we need to be responsive to our families. We know that things like child abuse and domestic violence are increased because parents are distressed. So being a lifeline for them is important, and for them to know that we're here, because we also know that those are not good things for kids. But I think you absolutely hit the nail on the head with routine. And the one thing I think adults can do is to emotionally regulate ourselves. When in medicine, when we talk about like a code blue, which is a resuscitation, one of the things is the person who's in charge should take their pulse first and take a deep breath, because if I'm in a panic, it's not going to go well. If I'm going to lead trying to save someone's life, I need to be calm. I need to do what I know to do. And I think parents can do that for kids. And I think you really said it pretty eloquently. You know, this is hard, but we're here. We're going to be okay. We're going to figure this out together. Maybe turning the TV off, I think, maybe, so that kids aren't hearing about all the bad and scary things that are out there in the world. Getting outside, I think, is a really important thing. And right now we're lucky. It's a beautiful summer day today. And finding the joy in the small things. So, I think, and sometimes in the spirit of Casey Ready For, sometimes it's a really great book. Find small things. We can always find time to read to kids, and we can't say enough about that.
Absolutely, absolutely. Well, Dr. Gugino, I just want to, again, on behalf of the entire community, thank you for all of your great work, all that you've done. Again, I'm still amazed at 32 years. But it, I think it speaks for itself. Your work around trauma, your expertise, your caring around the behavioral health, and understanding how it all fits together. It is one very uniquely intertwined system, and it's overall our responsibility as those health educators and those supporters to ensure that that system is as stable and as healthy as possible. And a lot of that work would not happen in our community without you, your dedication, and your expertise. So again, I just want to honor you and thank you for your work.
Thank you. Well, I have a lot of friends, so people, this isn't something you do by yourself. I'm just really fortunate. I'm kind of a nosy person, and I love to connect with others, and I think that's how you get things done. You have to be willing to do creative things and find other people to join you. It's really important that I have my peeps. And the Family Health Center serves a huge place in the community, and I think we're lucky again to have organizations like Casey Ready For's to make life better for our kids.
Absolutely. Absolutely. Well, thank you so much. And an extra special thank you to Casey Ready For's for all of their great work.
Absolutely. Thank you so much.